Here to talk about that is Dr. Ryan Dorin, a urologic oncologist at the Hartford Healthcare Tallwood Urology and Kidney Institute. Doctor, welcome.
Thank you. Thank you for having me.
It's our pleasure. Why is prostate cancer so important to men's health?
Well, prostate cancer is still the most common cancer that's not a skin cancer that men are diagnosed with in the U.S. and around the world. And still, even though we have modern treatments for this, about 30,000 men will die every year of prostate cancer. So it's very important to be up to date on your screening for cancer so that you can discover this early enough that it can be cured.
Okay, modern therapies or moderate therapies can achieve a goal for many men. What are modern therapies available?
Sure. So many men will have their prostate removed using a robotic, minimally invasive surgery. That's very effective. That allows people to go home usually the next day and in most cases be cured of their disease. There are also new radiation treatments that allow men to get a cure with fewer treatments and with less side effects. Beyond that, these days there's a lot of work that has been done on precision medicine where we're able to figure out the genetics of somebody's cancer and give them more tailored medications so that they get a higher cure rate and potentially fewer side effects.
That sounds very progressive. All right, how can a man best make sure he's getting proper health care and care for his prostate?
Great question. So every man of adult age should be getting regular physicals with their doctor. And then if you're over age 50 or maybe sooner if you have a family history or other risk factors for prostate cancer, it's very important to discuss with your doctor screening for prostate cancer with a PSA blood test at least every 2 years so that if you do have prostate cancer, it can be caught early where your chances of cure are highest.
All right, tell us about your upcoming webinar if people want to learn more.
Sure, we're very excited about this. Thursday, September 30th, 6:30 p.m., we're actually presenting a free webinar called A Multidisciplinary Approach to Prostate Cancer Care, where we'll go over all the latest treatments and how to best take care of these patients. This is going to be presented in Spanish, actually, to allow better access to Spanish-speaking patients. We'll talk about all of the common signs and symptoms and then and how to best manage it.
Let's talk about the signs and symptoms.
So anybody who's having troubles urinating, slow urinary stream, maybe urinary infections, that's a risk factor. Weight loss, pain throughout the body, those can be non-specific reasons for prostate cancer. But anybody who's having trouble urinating or if their PSA test is high, that's where you worry about a prostate cancer.
All right, and quick last question about family history. If you have a family history, should you really stay on top of it?
Absolutely, yeah, and that should mean that you'd get earlier screening than the average person.
All right, Dr. Ryan Dorin, thank you so much. Good information.
All right, thank you. Have a good day.
You too. Up next, one